Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions in Endocrinology 1. Let us start. A 40-year-old patient presents with enlargement of the hands, feet and facial features. Physical examination reveals coarsening of facial features, prognathism, malocclusion of teeth, excessive sweating, and enlargement of the tongue. The patient has a history of increased hat, glove, and shoe size. Laboratory tests show elevated insulin-like growth factor 1 and failure of growth hormone suppression during an oral glucose tolerance test. What is the most likely diagnosis? A. Cushing syndrome, B. Hyperthyroidism, C. Acromegaly, D. Hypopituitarism, E. Hypogonadism. So, these are the features. What is the answer? Answer should be C. Acromegaly. That is this case says the clinical features of acromegaly. So answer should be C. That is acromegaly. Let's go to the next question. A 55-year-old female with a known history of acromegaly presents to the clinic complaining of headaches and visual disturbances. Visual field testing reveals bitemporal hemianopia. What is the most likely cause of her symptoms? A. Compression of the optic chiasm, B. meningioma, C. Optic neuritis, D. Classic migraine, E. Occipital lobe tumor. Okay, so compression of optic chiasm, B. meningioma, C. Optic neuritis, D. Classic migraine, E. Occipital lobe tumor. So this person has headache, visual disturbance, and bitemporal hemianopia. So what is the site of lesion and what is the cause? History of acromegaly. So out of this, what is the correct answer? Answer should be compression of the optic chiasm. In the optic chiasm, the nasal fibers crosses, and nasal fibers represents the temporal field of visions. So lateral side of the vision of both eyes will be compromised. That is called bitemporal hemianopia. Our answer should be compression of the optic chiasm. Question number 3. A 30-year-old male is found to have elevated insulin-like growth factor 1 levels during routine blood work. Further investigation reveals a pituitary macroadenoma on imaging. What is the initial treatment of choice for this patient? So, what is the initial treatment for a patient with high IGF-1 pituitary macroadenoma? We have the choices: pegvisomant, somatostatin analogs, C. dopamine agonist, D. radiation therapy, E. transsphenoidal surgery. So what should be the answer? Okay, answer should be what? This is a case of macroadenoma of what? pituitary gland, which part? Anterior part. And there is the reason for acromegaly, so we must remove the pituitary tumor by transpenoidal approach. Okay, intranasal transpenoidal surgery, and we must take out this macroadenoma as much as we can. So answer should be E, that is transpenoidal surgery. We can call it intranasal transpenoidal surgery, okay, or hypophysectomy. So this is the answer. E is the answer. Let's go to the next question. Number 4. A 45-year-old patient with acromegaly is scheduled for transpenoidal surgery to remove the pituitary macroadenoma. What preoperative treatment can be used to improve surgical outcome by reducing tumor size? Okay, so it may be macroadenoma, it may be microadenoma. It is a tumor of the pituitary gland that is causing acromegaly. So we need to shrink the size of the tumor. So what are the best options for us? Bromkriptine, carbargolin, pegvisomant, octreotide, steroid. So what would be the best way to reduce the tumor size so the surgeon can take out the tumor at ease and can take out the entire tumor from the pituitary, okay, or from the sclera turcica area, content of pituitary fossa. The tumor there is to be removed. So what is the choice? Answer should be what? Is it steroid or octreotide? What is the answer? Okay, that is a pre-surgical medication. Answer should be octreotide. Octreotide. Okay. Then question number 5. A 60-year-old male with history of acromegaly complains of joint pain and stiffness. X-rays reveal degenerative changes in multiple joints. What is the most likely cause of his joint symptoms? So patient has acromegaly, joint pain and stiffness, 60-year-old, there is degenerative changes in multiple joints. Our choices are, what is the possible cause? Rheumatoid arthritis, osteoarthritis, gout, Paget's disease, pseudo-gout. Answer should be what? Answer should be osteoarthritis. Number 5. This is the answer, osteoarthritis. Okay, let's go to the last question. Question number 6. A 15-year-old patient presents with accelerated growth, excessive height for age, delayed puberty. Physical examination reveals proportional enlargement of hand and feet. Laboratory test shows elevated levels of growth hormone, hyperglycemia, and insulin-like growth factor 1. What is the most likely diagnosis? Marfan syndrome, gigantism, type 1 diabetes, primary hypogonadism, acromegaly. Okay, so 15-year-old patient, excessive height, okay, for age, delayed puberty, accelerated growth, and proportional enlargement of hand and feet. Laboratory test shows elevated level of growth hormone, hyperglycemia, insulin growth factor 1. What is the most likely diagnosis? Marfan syndrome, gigantism, type 1 diabetes, primary hypogonadism, acromegaly. Answer should be gigantism. Okay, this is the answer. It should not be acromegaly because he is only 15-year old. And that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.